you realize Minnesota tops the list as the healthiest state for seniors? We have a vibrant senior population in our community, and lots of people are facing the issues that come along with aging. And today we are going to talk about a lot of the resources that are available to you. Lots of seniors choose to stay at home rather than go into a nursing home or assisted living facility. And we're here today to talk with John Burkow from Senior Community Services about what resources are available to them. Thanks for joining us today, John.
You're welcome.
Tell us about your job.
Well, I have a pretty great job. I work for Senior Community Services, and I am the director of the Home Program, and that stands for Household and Outside Maintenance for Elderly. And so basically what we do is we help seniors with the things they need help with around their home. So for example, today it's snowing outside as I'm looking out the window. So our snow removal staff will be going out this afternoon and doing snow removal for our seniors, and that's very important, of course, so that they don't have any slippery surfaces going in or out of their home. Mm-hmm. In the summer we do lawn mowing. Year-round we do homemaking services, and we also do minor repairs. So as you can imagine, as you get older, especially like shoveling the driveway or mowing the lawn can become physically difficult. Mm-hmm. And minor repairs also, if you call a plumber, it can be quite expensive. Mm-hmm. And so we have very skilled, handy people, and they do all sorts of things from a dripping faucet to putting up a hand railing, whatever the client might need help with.
Okay.
And so by providing all these kind of chore services is what we refer to them as, that allows the senior to stay in their home and not have to do it themselves anymore and not have to go out and hire a service at a really high rate. We operate on a sliding fee scale, so we make it affordable for people based on their income. And we also use a lot of volunteers. In the summer, we get a lot of school groups that come out. We have volunteers from a lot of different corporations, Target, General Mills, just to name a few. And they'll come and they'll do bigger projects, like they might paint a fence, or they might, in the spring and the fall, they'll do a lot of raking. And in the summer, the kids will come. They'll sometimes help with gardening, maybe trimming some bushes, maybe getting that garage swept out or the basement cleaned out, things like that. So I find that, especially with the youth, our clients really enjoy having them. As you're probably aware, as a person ages, especially if they have to give up their driver's license, it can become a little lonely sometimes, even if you have family around. I mean, people lead busy lives, so it really makes their day to have a volunteer or a volunteer group come by and just provide that service. And we get a lot of notes of appreciation from our clients saying they just really enjoyed having the volunteers come by.
Mm-hmm. That's great. So a lot of my friends at this point are saying they have parents who have social issues, or they don't quite know where to go to get this or that service. How do they connect with you?
We get a lot of our referrals through existing clients. They'll tell their friends about it. There's a couple different information lines that people can call. Sometimes the city will contact if there's been like a citation. That happens once in a while.
You mean like for tall lawn or?
Yeah, tall lawn,
like
or sometimes for like a garage that might have peeling paint.
Oh, okay.
Sometimes if they're not one of our clients, they might get cited for an icy sidewalk, especially in the cities that have the public sidewalks like Minneapolis. Mm-hmm. So they'll call us. The city knows to refer people to us as needed. And we try to get out in the community, do things like we're doing today, interviews. We try to go to like senior health fairs, that sort of thing. Just try to be out in the community as much as possible and just make people aware of our services. Despite our best efforts, there's still a lot of people that don't know about us. Mm-hmm. So it's just kind of a continual thing that we do, going out into the community and trying to spread the word. So thanks for having me today to help me do that. I appreciate it.
Oh, I think it's very important. It really is. So what's new in your area?
Well, we just recently expanded to this West Tonka area. I think most of your viewers will be part of our service area. We cover most of Hennepin County, mm-hmm. but September 1st of last year, as part of a grant with the state, we expanded out to this West Tonka area. So we kind of took our successful model of chore service and just expanded it to a new area. We also started serving the city of Minneapolis the first of the year. So folks out in this area might not be quite as familiar with us, so hopefully we can continue to spread the word. We did do a lot of events last fall and try to get the word out as much as possible. So we're doing the best we can.
Yeah. So senior community services, and I just want to back up a little bit and tell people what that is. Because the home service is part of senior community services, which is a service provider throughout Hennepin County, correct?
Correct.
And
Yep.
it's, what kind of agency is it?
Well, we're an agency, I think we're a little bit unique in that we serve exclusively seniors. And so we have a couple of other programs. We have the senior centers, which is where we are today doing this interview. And we have some senior centers that we work with. We also have some caregiver support that we offer. We have licensed social workers on staff who not only provide support to clients who might need additional support or kind of need additional resources, someone to help guide them if they're struggling. The same thing could be said for caregivers. If you've ever cared for an older adult, you know how it can sometimes turn into almost a part-time or full-time job. And we have caregiver support groups. We actually offer coaching for caregivers because we recognize that they provide a vital need that our community has. They fill that need. And you know, it's really a great thing, and I would say an honorable thing to care for your aging mother or father, but it's just a lot of work, you know.
Can be.
We have an excellent, I guess you call it a web application. It's called CareNection, and that's a statewide thing. Anyone can use that. It's basically kind of like a tool where you can connect with the family members and you can coordinate care for the person that you're looking after. So you can go on there and make appointments. When you go to the doctor's office, you can put notes in there. There's a journaling feature. And so it's really easy if you have, let's say, mom needs to go to the bank. You can put that request out there, and then everyone on the care team can see that, and then someone can take that task. They could make some notes. Oh, mom tripped on the way into the bank, maybe sprained her ankle or something. Anything like that that happens that you want to journal, then it's easy to share it with the other people on the care team. You can print off a copy and take it to a doctor's office with you. So we offer tools like that. And then we also do some additional assistance. People who are having trouble paying their bills after Medicare pays, we have some assistance programs there as well. So we offer a lot of different type of supportive services that people might need, especially people that are lower income, that are struggling financially. I would say our programs, you know, somewhat geared towards them, but we serve people of all income levels. But most of our programs for assistance, it tends to be people who are struggling financially that will apply for those.
I know home safety is a very big issue, and how do you address that?
Well, our main objective is to help people stay in their homes, but we also want them to be safe in their homes. And something that we offer is called a home health and safety assessment. And it's got a long title, but it's actually one of our staff will go to a client's home, and we have a detailed checklist, and we'll basically spend about an hour with the client walking around their home with them. And we're looking especially for things that might cause falls. When I've done some presentations on falls, I found it startling in my research that 1 out of 3 adults aged 65 and older falls each year.
Wow.
And if you want to put that into another perspective, every 15 seconds in the US, an older adult in that age range is being treated for a fall.
Wow.
So falls are really a major source of concern for older adults and a major source of injury that happens when they fall. And so we want to do our best to try to prevent that. And so when we go into a home, we're looking for tripping hazards. We are looking for adequate lighting. We are looking for, does the client need a grab bar? Do they need a hand railing tightened up or added? We find that if you look at the statistics of all those people who are falling, less than half will actually tell their doctor about it. I think there's a lot of shame maybe in admitting that you fell, but people really should talk to their doctors. Maybe they fell because of a medication. Maybe they fell because they needed a new prescription for their eyeglasses. So I always encourage whenever I'm talking with a group or reaching out that if you have had a fall, tell your family members about it. Give us a call. We'll do a safety assessment. We'll try to get some devices in there that will help you stay safe. We'll look at the transitions in and out of your home because that's generally where a person falls when they're transitioning from one place to the next, going up or down the steps, going over a threshold into another room. And so we really work very hard We do this safety assessment, and then we actually use our handymen, and they'll go out and make as many of the repairs as they're able to do. So we follow the process from the beginning to the end, not only doing the assessment, but helping the person make the repairs. So I think it's a very vital service that I want people to be aware of so they can stay safe.
Thank you, thank you, thank you for telling us about that. And we know you must be very busy, man, so we appreciate your time today.
Oh, thanks so much for having me.
Okay.
I appreciate it.
We're here in the Gillespie Center at Mound to talk with Karen Buchholz. She's a professional volunteer, she tells me, one who spent many, many, many hours here at the Gillespie Center enhancing it and enhancing her own life too, I'm sure. And she's going to talk about some of the programs to make the lives of seniors healthier and happier. Karen, welcome.
Thank you. I'm so glad to be here.
Oh, I'm glad you could join us. Tell me what some of the programs are out here for seniors.
Well, one of the things that we really concentrate on is involving not only seniors but the whole community in a lot of aspects of our programming. So our programming comes from a very positive outlook, and it's to inform people in all different areas. And basically the three areas are motivational and individual involvement and the social aspect. And it's probably one of the most involved community service centers in the area because we have so many activities. And under the motivational aspect of it, Mindy does just an excellent job of...
Mindy Anderson, the director.
Mindy Anderson is the director, yes. And she sets up a lot of this programming, and it's just wonderful programming because it involves anyone that wants to hear information on life issues, health issues, social issues. So some of the things that we do have on the motivational side of making sure our health is correct, things like diabetes. We've had diabetes instruction, we've had dental instruction, we've had arthritis, other types of on caregiving, personal health issues, things like that. So it's more motivational, getting people involved in their life and being able to be aware of issues that may come up. And it's been very well attended, and we're always looking for more people that we're willing to teach things on health issues at the center, and they can contact the center for that. And so basically, when you come to these informational meetings, you oftentimes have, they oftentimes have like a video, or they show aspects of it so that you're more aware of what the motivational speaker is trying to instill in those people that attend. And they've been just wonderful. Another one is health insurance. They do different aspects of health insurance and long-term care, things like that. So we've had a lot of programs that just really open up a lot of avenues for people that are unaware. Mm-hmm. The one basic thing is, from my aspect anyway, is that I sometimes wish the people in the community read the paper more often, because we always have a listing in the paper of all the events that happen, so they can find out what programs are available and come to see them. So that's just a personal thing on my side. So that's basically the motivational side.
And then you talked about the other aspects, social.
The next would be more of the individual involvement, and we have quite a number of health issues that we do cover here that are individual. We have hearing testing, which happens on Tuesday, and it's happening right now. We have foot care. We have 4 different exercise classes. We have line dancing. So those are more of the physical types of things, but the individual. And along with that, we have blood pressure checks. Okay. And that happens usually on Wednesdays. So that gives people an opportunity to come in and have their health care needs met. And we do like to make sure that people understand that this is not a senior center in the sense of only seniors can be here or only seniors can be involved. This is open to the whole community. And so these health programs that are available to anyone regardless of their age. And that pretty much covers a lot of those individual types of programs. And then the third side of that is the social. And we do have quite a few social activities. We have an art club. We have a photography club. The line dancing is also social, even though it's physical also. We have 4 or 5 different card clubs that meet on a very regular basis. And in addition to that, they have a craft club downstairs in Hidden Treasures. And that's open on Wednesday and Thursday, and people can check by calling in to find out what the hours are for that. But there are a number of different activities that involve people directly. One of the things that we do like to do when people come in, and we have a bread program here also, which is every day. And the center is open from 8 until 4, so they can come in and get bread. And one of the things that's really nice is that the receptionists try to greet everyone so that they can ask them, have they been here before? Do they know what we offer them? And oftentimes we can give them the Gillespie Gazette. The Gazette can be received by anyone who comes in for a membership. And the Gazette tells about everything that happens each individual month so that people are aware of what our programming is. And we have an opportunity to tell people about the Gillespie Center. I think one of the things that amazes me is because of all the avenues that I've worked at here, is the number of people that live right in the community that either have never been here or have never heard of it. And when they come in for an event, like we have weddings here, and if people want to arrange to have an activity here, they can contact Wendy. She's in charge of the rentals. But in doing a lot of the things that I have is, one of the exciting things is showing the people around, and people are amazed at what a wonderful facility it is, and the opportunity they have to come either individually or for like weddings, receptions, things like that. So there's just so much here that people are just not aware of. And so it's a wonderful location.
It's
too.
beautiful. It really is. Karen, I wanted to ask you about volunteering opportunities, because I know you've really volunteered so many ways. And what have you gotten out of that?
Well, for me, I moved to this community about 10 years ago, and 8 years ago, I got involved by helping, first of all, with the gardening. And then I went into doing the reception. And as the receptionist, you are so aware of everything that's happening here. But for volunteering, people can just come in and they can say, I'd like to volunteer here. If they'd like to be a member, we have an application. We usually give them a Gazette at the same time so that they can be aware of what's available. Then they can choose what it is that they'd like to do, and that's also on the application. And then generally they might meet with Mindy to determine the avenue that they'll take and who they need to contact. We have seasonal activities. We're always looking for people that would just like to come in and help. Like we have hostesses for lunchtime. We have a particular social event that happens the 3rd Wednesday of each month. It's called the Jam. And it's a band with numerous members that come from all over, and lunch, and it's only $5. Where can you go for entertainment and lunch for $5? And everything is prepared here, so it's not catered in, it's not processed, that type of thing. But people have an opportunity to view the facility and then make decisions, and there's numerous, so it would be hard to mention all of them.
Great. Well, really want to thank you for joining us today. You've let us know what a great resource this is for our community, and we appreciate it.
Thank you so much for having me.
Well, now we're joined by Christine Zanakis. She's a program coordinator working with the staff at Senior Community Services. Christine, tell us about your job.
Sure, I'd love to. Essentially what I do is I oversee the work that's done for the home program. I oversee the workers doing the snow removal, the lawn care services, maintenance, painting. Essentially we have a staff of about 45 to 50 workers. We also utilize volunteers for some of those services for the seniors that are not able to afford the service. We do use county services through Hennepin County, such as Sentence to Serve. So they take minor offenders, people who have not paid traffic violations, things of that nature, to do the work and work towards paying off their debt to the county.
Interesting. So what is the profile of people who contact you for services?
Sure. Well, our services are able for all seniors that are age 60 plus living in most of the Hennepin County. Those are the only requirements that we do have for our program, but we often see caregivers calling us. We see family members, loved ones, neighbors, concerned people in the community calling, asking for service information, or the clients themselves calling and wondering what services are available. Typically, if we had to kind of narrow it down on a demographic of our client, usually it's about a woman in her early to mid 80s, typically widowed or living alone in a home or a small apartment condo.
Okay. So sometimes you might be dealing with someone who has some age-related issues. Does that ever happen?
It does happen quite often. As you know, over 5 million Americans are suffering dementia or Alzheimer's related diseases. We often get callers who call in, sometimes the chronic callers who call 3 to 4 times a day. They either forget or, they just get a little bit manic or panicked about the information and not remembering what we've told them.
Mm-hmm. And how do you deal with that? Not you, but how do you deal with the staff who has to deal with that?
Sure, we like to prep all of our staff. They're all aware of the age range of our clients. We just kind of reiterate that you do have to be patient with this demographic usually. Sometimes they're crotchety, sometimes they're the sweet old ladies that you'd love to see. We just reiterate that you should be patient and kind and talk slowly, speak loud if they can't hear you. And again, just the patience, reiterating that you may have to repeat yourself 3 times. And it's not to frustrate you, it's just they want to be clear on what's actually happening for them.
Mm-hmm. But you're really setting up a situation, as John mentioned, where this may be the only social contact that person has for the day. You must see some really beautiful stories come out of that.
There's some great relationships. We have one worker who's been with, the home program's been around for almost 40 years. We have a guy who's worked for about 30 years for the same client, and their story is pretty beautiful. He doesn't do any other work. He just mows and does the snow removal for this woman, and it's really sweet. It's great because that's what we encourage, a client-based relationship. A lot of them stay an hour after and have tea or cookies, and that's the highlight of the week for them.
For the volunteer or the staff and
for the client.
I'm sure it is, yeah. That's very heartwarming. So I know you don't deal with the volunteer area, but I did want to talk to you a little bit about how we'd connect with this service if we have extra time or skill to share.
Sure. So definitely you can reach out to the home program. We do giant volunteer pushes both in the spring and fall. Our goal is to go out and kind of get the yard prepped for the next season. So we do raking, weeding. Sometimes it's just putting out lawn furniture, making sure the hose is hooked up. We use volunteers all year round. Groups of all sizes. We have corporate companies that contact us. We have Boy Scout troops. We have small families and churches. So everyone's welcome, and there's always clients who are definitely grateful and wanting someone to visit with them or help them with something around their home.
Great. Well, thank you very much for talking with us today, Christine, and we appreciate it.
Not a problem. It was nice speaking with you.
We want to thank Gillespie Center and Senior Community Services for all this good information. And we encourage you to look for ways that you can open your heart to the seniors in our community. Thanks for joining us.